Hello friends, I am Dr. Girija, gynecologist by profession. The purpose of today's video is I want to create an awareness about cervical cancer among all the women. I'm surprised to see that most of the women are totally unaware about a cervical cancer screening test which are available. In fact, the World Health Organization, the WHO, has dedicated the month of January to create an awareness about cervical cancer. There is a huge burden of this disease globally. You will be surprised to know that every year we have 600,000 cases which are detected newly, the cervical cancer, and unfortunately there are 300,000 women we are losing globally. Okay, I mean it's such a huge burden we are facing. The good thing about this cervical cancer is we have a very good screening techniques by which we can screen the women, all women, for cervical cancer even before it becomes cancer, and treat it completely and then prevent women from getting cervical cancer. Probably this is the only cancer where we have such good screening techniques, and we want all our women to make use of this test and to fight cervical cancer. You want to also know what is cervix. Cervix is a small part of the uterus which connects the uterus to the vagina. Women infected with a virus called human papilloma virus or HPV infection. Okay, this is a sexually transmitted virus, and cervical cancer is mostly caused by this virus. Those who have exposed to smoking, and sometimes even those women with a weak immune system are also high risk, and mostly nowadays those women who are also not taken cervical cancer vaccination, which are called the HPV vaccines, are also at the increased risk of developing cervical cancer. What are the tests that are available, screening tests available for screening women for the early detection and the prevention of cervical cancer? As I mentioned earlier, we have a very good screening techniques. One of them is a pap smear. Pap smear test or pepinicular test. This is a very simple test, can be done in the outpatient department. It hardly takes 2 to 3 minutes for you to undergo this test. This is completely, it's not a painful test at all, because here we are not cutting anything, we are not scraping anything, we are just using a brush to take some of the cells from the cervix, put it in the container and send it to the histopathology. We also recommend to do the HPV virus co-testing in a woman that who are at a high risk of developing this cervical cancer. So who have to do the pap smear? So all women who are sexually active or those who are married, they need to screen for cervical cancer. Don't wait for the symptoms like to come in and then go to the doctor. You must do it even before any problems start. Even when you feel that you are healthy, you don't have any problems, still you must visit the doctor and do the pap smear test. Once the woman is sexually active, she should start doing this test. Till the age of 65 years, woman has to screen herself for cervical cancer. And how frequently you have to do this test will be decided on your pap smear results. Depending on the results, the doctor will advise you to repeat the test after 6 months, 1 year, or even up to, sometimes if it is all good, maybe even up to 3 years you may have to repeat it. All women must undergo this test, and we should together fight and eradicate cervical cancer. Okay, that should be our spirit. And also for those women with the daughters who have young daughters, they can also get cervical cancer prevention vaccinations are available, which are called HPV vaccines. It's available in most of the clinics, even including our clinic. So I insist and I strongly recommend that all women must undergo this test, and we should together fight and eradicate cervical cancer. So go get your pap smear test done today and spread the message to your friends, family, and we will eradicate cervical cancer together. Thank you.